Good morning, and welcome to Barbara's Bulletin. I'm your host, Barbara, and we're glad you're joining us today. We have a lot to cover, and we'll start with the developing story in the Middle East, where tensions continue to escalate. We've been following the situation in Gaza, where Israeli forces have launched one of the biggest waves of strikes in weeks. According to residents, the attacks have hit houses, tent encampments, and roads, causing widespread destruction and displacement. The Gaza Health Ministry reports that over 1,600 Palestinians have been killed since the start of March, and hundreds of thousands have been forced from their homes. The Israeli military says its actions are aimed at pressuring Hamas to release 59 remaining Israeli hostages, captured in October 2023. However, aid agencies warn that the total blockade imposed by Israel is putting the lives of hundreds of thousands of patients in Gaza Strip hospitals at risk. The blockade has also suspended a UN-backed polio vaccination campaign, which was meant to target over 600,000 children. We want to hear from all sides on this issue. Israeli Defense Minister Israel Katz says that Israel is acting in full accordance with international law, and that the humanitarian condition in Gaza is constantly monitored. However, Philippe Lazzarini, the head of the United Nations Palestinian Relief Agency UNRWA, describes the blockade as collective punishment of Gaza's people. As we continue to follow this story, we'll bring you updates from both Israeli and Palestinian officials, as well as from aid agencies on the ground. It's a complex and sensitive issue, and we'll strive to provide balanced coverage, giving voice to all perspectives. We'll also be exploring the diplomatic efforts underway to end the conflict. A Hamas delegation is due to arrive in Cairo for talks, and we'll be keeping an eye on any developments that may arise from those discussions. That's where we stand for now. We'll continue to monitor the situation and bring you updates as more information becomes available. We'll be right back with more of today's top news on Barbara's Bulletin. Welcome back to Barbara's Bulletin. We're glad you're still with us as we dive into our middle segment. Today we're discussing a thought-provoking topic that's been making headlines lately. Meet LZ Flanagan O'Neill, a freelance writer who's sharing her personal experience of moving back in with her parents due to housing affordability issues. Elsie's story is a fascinating one, as she explores the pros and cons of living with her parents as an adult. On one hand, she's able to save money on rent and utilities, which has been a huge relief. On the other hand, she's had to adjust to a new dynamic with her parents, navigating issues like personal space and independence. As Elsie writes, there is a cost of living with the parents, but the joys of moving home far outweigh it. She shares how she's been able to reconnect with her family and build stronger relationships with them. However, she also acknowledges that this arrangement may not be suitable for everyone, and that each individual's circumstances are unique. It's interesting to note that Elsie's experience is part of a larger trend, where many adults are choosing to live with their parents due to financial constraints or other factors. According to some studies, this phenomenon is becoming increasingly common, particularly among younger generations. Now, let's switch gears and look at a different perspective on the issue of parental involvement. Billy Mogus, a mother of 3, has been fighting for her right as a parent to opt out of certain storybooks in her children's school that promote controversial gender ideology. She believes that parents should have the final say in what their children are exposed to, especially when it comes to sensitive topics like sex and gender. Mogus' case is currently being heard by the Supreme Court, which has agreed to review the issue. While some argue that parents like Mogus are trying to impose their own beliefs on others, she counters that she's simply trying to protect her children from content that goes against her family's values. As we consider these two stories, it's clear that there are many complexities involved when it comes to issues of family, parenting, and personal choice. Whether it's deciding where to live or what values to instill in our children, these decisions can have a profound impact on our lives and the lives of those around us. Stay tuned for our final story of the day, right here on Barbara's Bulletin. Welcome back to Barbara's Bulletin. I'm your host, Barbara. As we wrap up today's show, let's take a closer look at the latest developments in the healthcare industry. We have two major stories that caught our attention, and we'll break them down for you in a fair and balanced manner. First, Elevance Health reported its first quarter earnings, with a net income of over $2 billion, despite rising costs in its health plans. The company's operating revenue rose 15% to $48.8 billion, driven by growth in its Medicare Advantage and individual membership, as well as acquisitions completed in the past year. However, Elevance did experience a decline in commercial fee-based membership due to a known customer transition. On the other hand, we have a story about Quantum Health's founder, Kara Trott, who saw an opportunity to improve the healthcare experience by creating a more consumer-centric model. Her company, now known as Elevance Health's competitor in some markets, has been working to drive improved health outcomes and cost efficiency for self-insured employers. It's worth noting that both companies are taking steps to reimagine the healthcare experience with a focus on personalized support, digital solutions, and whole health models. Elevance Health's president and CEO, Gail K. Boudreau, emphasized the company's commitment to delivering innovative risk-based capabilities and elevating health beyond healthcare. As we analyze these stories, it's clear that the healthcare industry is undergoing significant changes, driven by technological advancements, shifting consumer expectations, and evolving business models. While there are challenges to be addressed, such as rising costs and membership attrition, companies like Elevance Health and Quantum Health are working to find solutions that benefit both patients and providers. That's all for today's Barbara's Bulletin. Remember to like, share, and subscribe. And until next time, stay engaged.